cardiac surgery is the ultimate team approach, and it starts preoperatively and working as a team with the cardiologist and trying to decide what patient is best for cardiology management with stents or TAVR or MitraClip versus open heart surgery with bypasses, arterial bypasses versus vein bypasses versus valve replacement or valve repair or treatment or management of the aorta. And then once we decide that patient's going to go to surgery, we work with a team with our nurse coordinator, our physician assistants, and our nurse practitioners to appropriately risk stratify that patient, just to make sure that the patient themselves is not too high risk for surgery. And once we find that the patient is appropriate risk for surgery, then preparing that patient for surgery, we start a pain management program preoperatively by giving patients pain meds up front to help reduce the pain with surgery and afterwards. We also work as a team with the anesthesiologist. All of our anesthesiologists are cardiac surgery anesthesiologists who are specialists in reading special echocardiograms that we do during the operation, are very comfortable treating the anesthetic operations of the heart. We work with an excellent perfusion team that work the heart-lung machine. We have experienced, very skilled nurses and techs that help us assist with the operation. And then post-operatively, we work with nurses in the critical care intensive unit that's specialized for open heart recovery, in addition to nurse practitioner and a critical care team with evidence-based medicine protocols in place to ensure that all of our patients will have the best outcome. And then even towards the tail end of the recovery, we have evidence-based medicine protocols with our physical therapists, our occupational therapists, our speech therapists, in order to help that patient recovery as quickly as possible with the least pain and quickest return back to normal activity. And then once they leave the hospital, we work as a team approach, even with our home health care nurses, to ensure that they're getting excellent care at home and all of their needs are being met.